Hi, I'm Daniel Scherr, Head of EP at the Medical University in beautiful Graz, Austria. And we are an academic center doing about 900 ablation procedures a year, 700 implants, and happy to be partnering up with new PFA technologies, happy to be partnering up with Boston Scientific. So the benefits of FARAVIEW and the 3D integration of the existing PFA system are absolutely clear to me. That is coming from a very strong platform, the PFA platform that we've been working with for the last couple of years, FARAPulse, which has shown to increase lab efficiency and has the potential to improve safety aspects and also outcome aspects in our AFib ablation procedure. The next step now is 3D integration, is FARAVIEW. The benefits for me are, number one, the capability to do a 3D map. Number two, to track the lesions. And number three, to assess the lesions post hoc, meaning to do a left atrial voltage map. Let me compare this to skiing, which is very important in Austria. I think I'm not a good skier, but I'm a decent skier. But I think when somebody filmed me for the first time when I was skiing, this helped me to improve my skills. And hence, I think 3D mapping helps us to improve our PFA and ablation skills. Practically speaking, the most important aspects, I think, when you start new with your FARAVIEW experience are, number one, make yourself familiar with the features and the system itself, the features that the system offers. Number two, take your time at the beginning to do a 3D map of the left atrium. Now later on, you may end up skipping this, but at the beginning of your experience, I think it is important, at least for the first cases, to do a 3D map of your left atrium, especially posterior wall and the pulmonary veins. Number three, make use of the lesion tracking because it will improve your circumferential PVI lesions, knowing where you have been, knowing when to turn the catheter and how much to turn the catheter, not only on X-ray, but in the 3D environment. And number four, use the system to validate what you have done and to map the left atrium and the pulmonary veins after your ablation lesions. Manifest Redo, I think, was an important study for the community and for PFA as a whole. In the day and age when new technologies come out almost every month, registries are very important to track the safety aspects, to track the efficiency aspects, and also to help us learn and understand what to do better. In that respect, Manifest Redo was a study looking at redo procedures of the Manifest cohort. The Manifest cohort consists of 22 European centers putting together their early experience with the FARAPulse catheter. And in the Manifest Redo study, we analyzed the redo procedures of that cohort. With regard to the results of the Manifest Redo study, I think there are three key learning points. Number one, reablation works. So if a patient after a failed PFA ablation comes back to the lab and the reablation is done, the 1-year success rate is 70%, which I think is a really good number. With paroxysmal patients and atrial tachycardia patients doing a bit better. Learning number two, we still need to work on PVI durability. In those patients that came back for reablation after a previous PFA ablation, the PVI durability rate was 71%. So there's room for improvement. On the other hand, we have to consider that 71% PVI durability in such a cohort is a number that has never been published with RF and cryo, with the results in redo populations with RF and cryo being lower than that in previous studies. And finding number three, imaging may add something. So in those patients that had undergone PV isolation with the help of some imaging or 3D mapping technology, the PVI durability rate was significantly higher than in those where an imaging technology was not used.